Oh, actually, I started out as an art therapist, right? So I got my master's degree many decades ago in art therapy. And from there on, I moved into learning more about mental health. I think sometimes that's how we start out. And I started out in visual art. And of course, art therapy seemed like a really wonderful thing, even that I didn't know what it was. It sounded like that was the thing I wanted to do. So I spent a lot of years studying that and then studying clinical mental health counseling in the United States, which is, another branch of psychotherapy, and then working towards a doctorate in psychology. So that was kind of my progression. But over the last probably about 15 years, I started to think about more deeply about my work with traumatized individuals and what they really needed. And part of what I realized is they needed something a little bit different than just visual art. So what I'm going to try to explain today is how I started to move my thinking into a broader area, even though my work centers in the visual art. That's my core of what I learned first, and it's always stuck with me as someone who's interested in visual art. But I branched out into what we call expressive arts therapy, which I think complements using visual art in trauma work. So that's the philosophy I want to help you understand today, and how you can take art therapy and actually expand it. Because what our purpose really is in our work is to how to help the patient or the client in the best way possible. And sometimes we have to move outside of one way of working in order to help them. So, a lot of us have different philosophies and techniques. We might use cognitive behavioral therapy, or you may be more psychoanalytic, or you might use some different method. But I found that getting people active through a lot of different senses, so to speak, in expression is really what was the most helpful. And when I'm saying different patients and clients, I'm talking about children, I'm talking about adults. In fact, I work mostly with adults right now. I'm talking about groups, and I'm talking about families. So all of this pertains to all those different kinds of patient populations. The main thing that's involved in most of the work for me is addressing psychological trauma of some kind, either acute trauma or stress, some kind of traumatic stress, or post-traumatic stress, which is part of what we see in the United States. And I think we're going to see, unfortunately, a lot more of it. This probably is going to be true in Brazil, that a lot of us are getting quite traumatized if you work even in the healthcare field as a mental health practitioner, or if you work in a hospital. We're already seeing in the United States, unfortunately, because of the pandemic and the stress on the hospital system, a lot of people already in healthcare professions being diagnosed with post-traumatic stress. So I think we'll have a lot of work to do, and hopefully we'll be able to work on ourselves too and take care of ourselves as we move through, hopefully, this pandemic over the next year, and start to come back into whatever the new normal, they keep calling it new normal. But when we're back together again and working together and being together without the major threat of this virus and the threat of the stress. So my core is as an art therapist. But if somebody needs movement, and somebody needs music or sound, somebody needs play, somebody needs creative writing, I need to find ways to help them expand their expression, because trauma is really complicated. Trauma requires a lot of different access to the senses in order to help people recover. And what I always say, restore the self, come back to the good parts, the playful parts, the curious parts, the imaginative parts, the parts of the body that got robbed when trauma took place. Because when we're traumatized, we're not having any fun. We don't have a lot of pleasure in our daily existence. We're in a lot of pain. And I think this is the real thing. I'll probably say it multiple times. Using expressive methods that involve the arts really help bring the body back to being alive and having pleasure again after being traumatized, hyperactivated or anxious, or very withdrawn or numb and not even feeling one's body anymore. So another way when I talk to groups of counselors who maybe are not art therapists in any way, I always say we can think about these methods as expressive. How do we help people be expressive? Because one of the hardest things for people who are traumatized is to be expressive again. There are a lot of the ways that they were expressive in the past go away because your body just gets shut down and stuck right in the trauma and in those painful reactions that people have when they're traumatized. So I think it's one way to open up various pathways to learning to play again. So I always say that first because one of the things I learned decades ago, and nobody had taught me in graduate school, we didn't talk decades ago about trauma as a major problem for people. And my first job was, as I said, working with children who had witnessed violence in their home. They'd seen interpersonal violence between their parents or caretakers. They also may have been abused themselves. They are also usually children who may have been neglected or verbally abused or assaulted in some way. When I first walked into the very first sessions with those children, being hired to come in as an art and play therapist, they didn't know how to play. And a lot of them didn't even understand the art materials. They had not been exposed to that in their families. Their families were very, probably didn't have the money, were not inclined to introduce art, making, clay, drawing to the children. So I thought to myself, wow, they really don't know any of these things. But part of why they didn't know how to play, they were afraid to play. They had lost that ability because being children in a domestic interpersonal violence situation didn't allow for play. Play was actually maybe a dangerous thing to do. And they also had lost their curiosity about things because they were so fearful. And they had to be for survival, because that's the way you adapt. If you're fearful, then you're always watching for danger. And they needed to watch for danger. Their lives were dangerous. So I started to think a lot at that point about how do I help them become expressive again and actually enjoy being children again, right? Because that's what being a child is about. You play, you're curious, and the adults around you help you experiment and help you learn to play and have pleasure in that. So that was one thing I thought about, just what we're doing is about expression. The other piece about what we do that's really important is that we help people of all ages through the arts self-regulate. So we help people who are very hyperactivated, anxious, worried, fearful, all these things that make our heart rate accelerate, that make our breathing increase, that make us more stressed. What we do in the arts, and we know this now through many, many studies, it helps the body to self-regulate, to bring down the level of stress. And that's something that often is pretty hard to do with just talk therapy alone, that we actually engage the body in ways that calm it down. So that's another reason, expressive methods are so important. The other term I use here is from scientist Stephen Porges, who has developed what we call polyvagal theory. I will come back to that later in the presentation. But how we can use expressive methods to help people socially engage, right? So we, as therapists, even if we're just working with one person, we are establishing this positive social engagement. But we're not just doing it through talking. You can do it through talking. We're adding the senses in there to make it playful, to make it an experience that people feel pleasure and fun in. So that can be true for children, but it can also be true for many, many adults. They relearn through our psychotherapeutic interventions through the arts, how to socially engage again. And then if we're working with them within groups, we have that opportunity to pull people together through the arts to engage with each other. So I just think what we do is such a value added to the work of psychotherapists that I, in some ways, cannot understand how. I don't think I could just do talk therapy. I can have a conversation with people, but I need to introduce these senses because it's so much added to the session, I think, for people beyond just the talk alone. And I'll keep coming back to this because talk is up here. It's in our higher brain. It doesn't really touch our bodies in the way that the expressive work does. So when I come down to thinking about this, there's also the component of imagination and imagining a new narrative because people have been stuck in a narrative of trauma. And how do we gradually bring them through towards their healing and recovery, but giving them the ability to imagine a new way of seeing life and communicating about what they've experienced. It's also about the repair of the trauma in that sense. And I always say the restoration of the self, because I think that's what's been wounded in the trauma itself. The self has been taken away, or people don't know who they are anymore. Or even if they do know who they feel that they are, it's very uncomfortable, the identity of trauma that they've taken on. It's a painful identity. So how do we restore the good self, the positive self, the self that has pleasure in life? And then for others, it's relearning or sometimes learning for the first time how resilience can help them get through and how we build that through expressive arts. So how we touch the body and mind in that way and help people develop that needed resilience, because we all need that. I think that's the big thing right now in working with people. And I don't know how much you're doing it in Brazil. It'll be interesting to be able to talk to you in a little while about that. We work through this screen because we're not meeting people in an office because of the pandemic. And trying to work on resilience is a really important piece because right now there's so many challenges for, of course, for people in the United States, some more than others because they have socioeconomic and cultural barriers to their health and well-being. So how do we help them find resilience through mastery and building competence through these expressive methods? So those to me are really, really important things that we do, I think, actually pretty well in comparison to talk therapy alone.